Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over 10 causes and risk factors for lumbar radiculopathy. It's very important to understand those causes and risk factors because with a lot of cases, if you eliminating those causes or risk factor, you will decrease your risk of having lumbar radiculopathy or decreasing the symptoms that could aggravate it. So before I go over those causes and risk factors, we need to understand what is lumbar radiculopathy. Usually you will have compression on the lumbar spine and usually from L4 to S1 around this area that compressing on the nerve, and you start to have sharp shooting pain going down to your legs. And I will leave a link underneath this video on how to diagnose lumbar radiculopathy, that clinical testing that we use it in a clinical setting to diagnose lumbar radiculopathy. So the first cause and risk factors is actually herniated disc, and this is very blown out of proportion with a lot of patients because everybody say that's because herniated disc. No, it's not. There's other causes that's more common than herniated disc, and I will go over it in the next slides. So herniated disc, that's basically when your disc, this is a disc, this is your vertebra, this is a side view. The disc is actually compressing on the nerve here that going down to your legs, and that could cause, this is one of the causes that are blown out of proportion with a lot of patients. So the other cause is osteoarthritis. When you have arthritic changes around this area, it's actually could compress on the nerve that going down to your leg. Spinal stenosis, that's usually happen when you have narrowing in the spinal canal, and that's the area of the spinal canal that where your spinal cord is going in the canal, like here, like this, and usually you will have a few millimeters just a space, so it's not compressing on the nerve. But when you used to have a spinal stenosis, that's narrowing in the canal and could compress on the nerve and cause lumbar radiculopathy. The more common causes and risk factors and overlooked by a lot of healthcare providers is poor posture. Number four is poor posture. It's very common with the people who slouching forward, have working poor posture, poor body mechanic with lifting that could cause lumbar radiculopathy. So posture extremely important, that overlooked, and it's a very common issue that could trigger or cause lumbar radiculopathy. The other common issue that is overlooked is performance syndrome, and I will have a link specifically on performance syndrome. Performance muscle is attached here in this area, and when you have tightness, fibrotic tissue, or muscle spasm here, it compress on the nerve going down. And I had patient that all healthcare provider keep looking in the back, herniated disc, herniated disc, herniated disc, had treatment and injection for the herniated disc, but nothing resolved the symptoms, because when I evaluated that patient, it was the performance syndrome that compressing on the nerve, and everybody was looking in the wrong place. So it's a very overlooked. So you need proper evaluation to really figure out if that's an issue, not coming from the back, it's coming from the muscle that's in the buttock area. Performance syndrome. Number 6, poor body mechanic with lifting. That's a very common one, actually, especially when you lift and twist your back. That could cause damage to your back with poor body mechanic. That could cause lumbar radiculopathy. So those three are extremely common and overlooked. So it's very important to address these. So number 7, whiplash or injury. That's like motor vehicle accidents or fall or accident for off the bike or falling on the floor. So that could cause the lumbar radiculopathy. The other issue could be number 8 is spondylolisthesis, which is slippage of the vertebra, and you can see it here. That's more like fracture here. That's usually happen from accident trauma, or you really have a bad degeneration with the poor body mechanic, poor posture that could cause that fracture here. Less common is tumor in the lumbar spine and or the spinal canal. The number 10, which is really rare, is Coda equina syndrome. So I'm gonna leave a link underneath this video for the 3 most effective approaches to treat the root cause of lumbar radiculopathy. We'll see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.